Brought to you by ExpressCare Health and Skin Center. Get in, get out, get better.
All right, welcome back, everybody. We are talking about your health, understanding your body, and hopefully giving you some tips on how you can live a healthier life. Now, Dr. Jitka Lom is here, our dear friend from ExpressCare. Welcome back, Doctor.
Thank you.
Okay, we are talking tonight about nighttime leg cramps and a curious situation called restless leg syndrome. Now, night cramps, I know most people have had them either when they're working out too much or they don't work out at all and everything. And most of us wake up in the middle of the night and scream in utter pain because either our calves look like softballs in them, or our toes are all curled up and everything like that. What causes that?
Right. So you alluded to a couple of the things. First of all, about half the population, especially over age 50, gets these leg cramps. And you mentioned sitting or not exercising at all. People that have a sedentary lifestyle and they're sitting all day long aren't getting the circulation going, and their muscles aren't stretching. And so at nighttime, everything will kind of get very tight. So that's one extreme. The other extreme is working out maybe too much but not stretching afterwards.
Not cooling down.
Not cooling down, yep. So basically it ends up to be a bit of a circulation issue, a bit of a muscle stretching issue. And then finally, sometimes there's also deficiencies of magnesium, potassium, sometimes iron deficiency can cause this, and some medicines can also cause it. So there can be other health problems along with it.
Would this have anything to do with like either high or low sodium intake?
Sodium will get balanced out really pretty well in our body. Our body's very, very good at managing sodium. The magnesium and the potassium tends to be the ones that get us in trouble. Low potassium, from a lot of sweating during the day, or the magnesium, basically it's a nutritional deficiency. And we get magnesium from the green leafy vegetables. Of course, that's sometimes hard to come by. And so typically people will be a little low on that, and they'll experience cramps, they'll experience insomnia, and sometimes they also get constipated if they aren't eating enough magnesium. So if you're getting leg cramps, a simple way to rectify it is take a little magnesium. And
so you want to have like enough potassium. Yet another reason, boys and girls, to have bananas around your household.
It's true. Yeah, that's for your potassium. Yep.
Well, you were mentioning earlier about a lot of people over 50 get leg cramps. Is this more common when you age and the body just, is more prone to
it is. There's a couple factors there. Typically people are not as active, that's one thing. And another thing is their circulation isn't as good. They may have varicose veins also affecting the lower extremities. So again, that's a circulation issue. Blood is pooling, not moving as well as it should. And they may have other health conditions like being on certain medications that might aggravate it.
Since you brought up varicose veins, that is a subcondition of some women who are expecting.
That is true.
Yeah, so do pregnant women
get... Yes, they do. Pregnant women, I had them as a pregnant woman, was horrible.
How often?
Yeah. Oh, I mean, it went on for months. It was really difficult. But so that's partly due to weight gain also, that again, your circulation may not be as good. And varicose veins definitely do come along when you're pregnant too sometimes.
Now, I'm just throwing out all these different environmental conditions that may cause it. How about changes in temperature? Because a lot of us, here on the island, because it gets so hot into the night, we put the air conditioning on full blast. And then, of course, like when the dew point drops, like right around 4:03 a.m., thereabouts, it can get like a little bit cold. If there's a sudden shift in temperature one way or the other, may that cause it?
It could aggravate it when your muscles get cold, and they'll cramp up a little bit more easily than when they're warm and stretched. So bottom line of all this is, so you don't get leg cramps, make sure you stretch. If you don't have time to stretch during the day, a simple way to do that is before bed, lie down on the floor, put your legs up on the wall like an L shape. So your feet are up high and you're draining all the blood down, so you get a nice change of the circulation there, okay? So do that before bed. Stretch your calves, curl your toes and stretch those out a little bit before bed, and then take a little magnesium and a little potassium, and that might help you.
Now that's also something interesting, because like if most people say like a family member like walks in and you're lying in that L shape and everything, they're going to think, oh man, The Exorcist, or something like that.
No, you just tell them you're doing a yoga move and draining out your toe blood.
Oh, very cool. Now a lot of people, when they wake up with like toe cramps, the thing that's probably most painful and most disorienting about it is most of us are in a deep sleep when that happens.
Yes.
And so you wake up because you feel uncomfortable, and a lot of times shooting pain.
And you can't even move sometimes. They're curled so tight that
you're half asleep.
You can't even move, yeah. So start rubbing them, okay, rubbing your calf or your toes, that helps a lot. And then forcing it in the other direction, stretching the toes and forcing it. And then right away remember, okay, well this is happening because I'm either dehydrated, my potassium's low, my magnesium's low, or it's maybe due to my medication. or my circulation, and that'll help you not get them the next night.
For people out there that may be experiencing leg cramps, toe cramps, calf cramps, and everything like that, chronically or repeatedly, maybe even perish the thought several times per night,
Right.
What should they do?
Well, if they've done all those simple things, then maybe you need to have a visit and try out some medication. Sometimes it'll help you to use a muscle relaxer. Other times we use a medicine for nerves, because a lot of this is kind of nerve-related pain, and we use a medicine called gabapentin, or maybe you've seen Lyrica on TV. This is also typical with diabetic people. They'll get that pain in their feet, especially, or in their cramps. Yeah, nerve pain. So that medicine does help, but you want to try to stay away from medicine and do the simple things first.
Okay. Well, we tackled nighttime leg cramps. We're going to talk about restless leg syndrome on the flip side of this break, everybody. So stay tuned. Dr. Lom and I will be back right after this.